2025, former U.S. President Donald Trump at that time announced plans to withdraw the United States from the World Health Organization, WHO.
This decision follows a history of criticism from Trump's administration, which accused the World Health Organization of mismanaging the COVID-19 pandemic and failing to implement urgent reforms.
Now, he's now the president, and our science and health reporter, Elizabeth Atieno, tells us what this move means for Kenya and Africa, and of course, the global health sector. This, of course, as the WHO urges the United States to reconsider its position.
The fate of the World Health Organization, founded in 1948, now hangs in the balance after U.S. President Donald Trump signed an executive order withdrawing the United States from the World Health Organization, citing mismanagement of the 2022 COVID-19 pandemic that arose in China, as well as its failure to adopt urgently needed reforms and its inability to demonstrate independence from the inappropriate political influence from the United States. The executive order further states that the World Health Organization continues to demand unfairly onerous payments from the United States, far out of proportion with other countries' assessed payments, giving an example of China, which has a population of 1.4 billion people, yet contributes nearly 90% less to the World Health Organization. The United States, which is the top donor and partner to the World Health Organization withdrawal, means the organization is projected to lose a huge chunk of funding, which is mostly channeled towards responding to outbreaks and other global health emergencies, considering U.S. pays membership dues of roughly $110 million annually, further contributing approximately $500,000 every year as donations, which equals to about 1/5 of WHO's budget.
For 7 decades, WHO and the United States of America have saved countless lives and protected Americans and all people from health threats. Together, we ended smallpox, and together we have brought polio to the brink of eradication.
And that's not all. The withdrawal would also isolate WHO from U.S. agencies like Centers for Disease Control, CDC, and the Food and Drug Administration, FDA. Apart from the U.S., other key contributors to WHO include Germany, Bill and Melinda Gates Foundation, Gavi, European Commission, United Kingdom, Canada, Rotary International, Japan, and France. The executive order by Donald Trump has equally directed that all future transfer of any U.S. government funds to WHO should be paused. U.S. government personnel working with the WHO have been recalled and will be reassigned. The 2024 U.S. Global Health Security Strategy will also be reviewed, withdrawn, and replaced. Thereafter, the Secretary of State shall immediately inform the Secretary General of the United Nations and the leadership of the WHO of the withdrawal. U.S. withdrawal from the WHO also means that the United States will lose its voice in the World Health Assembly, an annual meeting of member states that elects the WHO Director General, reviews and approves WHO's budget, and sets policies on issues such as disease eradication, tobacco control, and vaccine equity.
The United States was a founding member of WHO in 1948 and has participated in shaping and governing WHO's work ever since, alongside 193 other member states, including through its active participation in the World Health Assembly and Executive Board.
An exit will take effect in January 2026 at the earliest. It would put US as the second UN member country which is not in WHO. According to the executive order, while withdrawal is in progress, the Secretary of State will cease negotiations on the WHO pandemic agreement and the amendments to the international health regulations. In a rejoinder, the World Health Organization has urged the United States to reconsider its move, further stating that they are looking forward to engaging in constructive dialogue to maintain the partnership between USA and WHO.
WHO plays a crucial role in protecting the health and security of the world's people, including Americans, by addressing the root causes of disease, building stronger health systems, and detecting, preventing, and responding to health emergencies.
The World Health Organization's roles in Kenya include policy and technical advice, spearheading health research, setting norms and standards for health in Kenya, monitoring and assessing health trends, establishment of universal health coverage in Kenya with a focus on primary health care, and establishment of budgetary measures for health. Elizabeth Atieno, TV 47, Nairobi.